Hello, and welcome to Bite Size MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Type III Hypersensitivity under the section of Immunology. So, what is Type III Hypersensitivity? It's an immune complex mediated, which usually involves IgG. So if you recall, we have four types of hypersensitivity reactions. Type 1 is IgE mediated, type 2 is IgG or IgM mediated, and type 3 is an immune complex mediated. And type 4 is a T cell mediated delayed hypersensitivity reaction. If you like a refresher of type 1 and 2 hypersensitivity reactions, please click at the appropriate corner of the recording. So in type 3 hypersensitivity reaction, we have immune complexes, which are basically antigen antibody complement complexes. And they usually involve IgG, as previously mentioned. So it's an antigen antibody complex that activates the complement system. As a result of that, it attracts neutrophils, which release lysosomal enzymes. The examples of these include systemic lupus erythematosus, rheumatoid arthritis, and post-streptococcal glomerulonephritis. If you would like a refresher on systemic lupus erythematosus or rheumatoid arthritis, please click here, which will link you directly to our already completed rheumatology section. So the examples of type 3 hypersensitivity reaction includes serum sickness. So you have antibodies to foreign proteins that form normally 1 to 2 weeks later after being exposed to an antigen. And as a result of that, you will have an antibody and antigen complex that's being formed, which then will get deposited into the tissues, which will then activate the complement system, resulting to inflammation and ultimately resulting in a tissue damage. And that's where you, for instance, you get your low serum complement C3 and C4 in a case of active systemic lupus erythematosus. It's frequently associated with fever, urticaria, arthralgia, and proteinuria, as well as lymphadenopathy, normally about 1 to 2 weeks after being exposed to the antigen. And it may also be associated with some drugs, which include penicillin, monoclonal antibodies. And it can also occur after being exposed to some infections. The classic example of that for the purpose of MRCP examination is hepatitis B. So let's look at an example, which is what we call an Arthus reaction, which is an immune complex mediated reaction. It's localized and it's normally in a form of subacute. It's technically an intradermal injection of an antigen into the prepositioned individual that they normally have that circulating IgG, which as a result, it will lead to immune complex formation. The example include a local reaction to a booster vaccination, for instance, which could result in edema, fibrinode necrosis, and complement activation. It's also been reported that with vaccination, including tetanus, diphtheria, hepatitis B, as well as even some insulin injections. So as far as the investigations, you would really want to be trying to investigating the underlying cause or condition that has resulted to the reaction. And that will depend on taking a thorough examination of the patient, as well as taking a thorough history. So let's do some questions. Question 1. A 45-year-old male with history of chronic hepatitis C infection undergoes treatment with oral amoxicillin for a dental infection. After several weeks of therapy, he develops arthralgia, skin rash, and a palpable purpura on the lower extremities. Laboratory investigations reveal decreased complement levels. Which of the following conditions is most likely responsible for the skin rash and palpable purpura in this patient involving a type 3 hypersensitivity reaction? So the options are A, rheumatoid arthritis, B, systemic lupus erythematosus, C, serum sickness, D, polyarthritis nodosa, E, Goodpasture syndrome. So recall that this is a classic case of somebody with a history of hepatitis that has recently had an infection and required antibiotic treatment and has come up with a classic purpuric rash concerning for a hypersensitivity reaction. And if you remember, as per our discussion, the correct answer in here is going to be serum sickness. Thanks for listening to this episode of Bite Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.